Good morning, everyone, and welcome to the Delivering Change Together event briefing. My name is Susie Healy, and I'm the Communications and Digital Officer with HSE Organisation Development and Design. And over the next few minutes, I will introduce the Experiential Change Programme to you, and I will give you an overview of the event that is planned for next month in November 2023. So the event is taking place on Thursday, the 16th of November at the Radisson Hotel in Sligo. The event is a celebration of the pilot programme Delivering Change Together. This programme was first launched in Sligo on the 27th of January and about 170 people attended on that day. This experiential change programme, it has brought colleagues together in communities of practice groups. On launch day, 8 communities of practice were formed with 59 participants. They are a diverse group, multidisciplined, and they come from across the service areas. They formed networks to support peer-to-peer change management learning. So the programme objectives, first off, this is an initiative of the West Northwest and it is the first of its kind in the HSE. It is co-sponsored by the CEO of Saleety University Healthcare Group and the Chief Officers of Community Healthcare West and Community Healthcare Cavan, Donegal, Leitrim, Monaghan and Sligo. So the objectives are to support the development of further change management and project management expertise across the health services in acute and community to enable integration and service priorities, to share direction and mainstream the health services change framework, to build relationships and networks including communities of practice, and to ensure that reliable methodologies to drive change and improvement activities are available in a standardised manner. So the programme began on the 27th. You can see here that it began with a masterclass with Helen Bevan, who introduced the concept of communities of practices, and there were 5 other meetings in 2023. There's various activities that took place. Some were undertaken in virtual meetings and others were in person. And it culminated in final presentations. So that's what's happening on the 16th is the final presentations of the groups. This was developed in partnership. It is a collaboration between the respective programme management offices in the partner organisations with the support of National Organisation Development and Design. It was developed as a result of a needs analysis with nominated participants from all 3 organisations, including Public Health. So collaborating for change, the programme encourages colleagues to work collaboratively in communities of practice to solve common problems when designing, defining and delivering change. Communities of practice were set up to focus on sharing best practices and creating new knowledge to advance a domain of professional practice. A community's specific purpose and goals inform the appropriate activities and technologies that support it. So each one is unique, or they have their distinctive needs, and their work and services that they provided with are customized to the needs that each particular group has or their project that they're working on. The programme to date has included support from local virtual sessions, All Changes Local, Getting It Right, Health Services Change Guide and the associated e-learning programme on HSE Land. Key offerings based on needs on project management, methodology, QI, leadership and national offerings on developing change capabilities. The purpose of the engagement event on the 16th is to share learning and look at how Delivering Change Together programme and communities of practice can help to support colleagues implementing the health regions. So on the day, we will be joined by CEO Bernard Gloucester, Liam Woods, Tony Canavan, John Fitzmaurice and Dermot Monaghan. And together we will hear from 8 communities of practice from the West Northwest region who have been working collaboratively to support change in their service areas. Change advisor and healthcare strategist Helen Bevan will deliver a presentation on the day also. So on the day, we'll open at 9:30 with an address by the CEO, Bernard Gloucester. Following that, we'll have a senior leaders discussion with Liam Woods, Tony Canavan, John Fitzmaurice and Dermot Monaghan. And then there will be a network session. And then after a short break, we'll have testimonials by the communities of practice. Awarding certificates will happen at 12 o'clock to all the participants, and then in the afternoon there'll be a keynote presentation by Helen Bevan. So how can you support us? On X, please follow these accounts and retweet and comment using our hashtag delivering change together and hashtag integrated change posts. We'd really appreciate it if you could keep an eye out on these accounts, because we'll all be tweeting on the key dates, which are the 15th, 16th and 17th of November. HSE Change Guide, that's the account I run, and I'll be tweeting in early November about it. So any support you can offer is very, very welcome. But the key dates are the 15th and 16th of November. Also, we have a LinkedIn account, so if you can join our network on LinkedIn and share our posts with your network, that would be fantastic. The page that we run is Health Services Change Matters. And again, they will be using those hashtags there. And the key dates again are the 15th, 16th and 17th of November for including in your content calendar. So you can help support us by helping spread the word by featuring an article about delivering change together about the program in your newsletter or your all staff email. And also this is help us. We're asking you to help us to celebrate the work and involvement of participants from your region who have benefited from taking part in this program. So across the regions, we'd appreciate some focus on that element of it. That would be the main focus that we'd be seeking. So if you need any assistance, please do email me, susan.healy2@hse.ie. I can supply copy and photos, generic photos if you need them. But again, we'd really like focus to be on your individual groups.